spare me the improving healthcare when you just ripped healthcare away from millions of people.
By reauthorizing rural health services outreach programs, this bill will lead to increased access to healthcare services and preventative screenings, improved chronic disease management and health outcomes, expanded telehealth services, and reduced emergency department visits for the nearly 500,000 individuals who receive direct services for these programs annually.
It moves me to hear my colleague from Georgia speak about improving rural health when we just took 10 giant steps back with the big ugly bill that cuts Medicaid, that cuts funding to rural hospitals, is going to make rural healthcare devastatingly worse. 20% of rural hospitals throughout the whole country are going to close because of that bill. They've been sounding the alarm. They're saying it. In addition to that, millions of Americans, citizens, are going to lose healthcare because of this bill, mostly because of the bureaucratic nonsense. In fact, Georgia's having a hard time right now trying to recruit Medicaid eligible patients under their own work requirement rules. The funding for rural hospitals are going to go down. States are going to have to pony up. States cannot increase their revenue based on the big ugly bill like they used to with the provider tax and other programs that are also decreased. States are going to have to make hard decisions. Physician reimbursements on eligibility, benefits offered through the Medicaid program. So what does this mean? Yes, this bill may take a tiny step forward in helping emergency departments, but emergency departments are going to get busier because more people are going to be uninsured. And when hospitals close and you don't have an emergency department, people are going to have to travel longer to get emergency care. If you have a stroke and you can't get to a stroke center within your 10, 15 minutes, your risk of permanent injury or death skyrockets. That's not politics, man. That's medicine. Those are science. Ask any doctor whether time is of the essence for a stroke or heart attacks. So, yeah, you all are going to say we're improving healthcare in the backdrop of kicking healthcare's ass, where people are going to die because of this bill that you just passed. 10 giant steps back. And now you're going to say, oh, we're going to improving healthcare with one tiny step forward? Come on. It just irks me because as an emergency physician, I know the pain and suffering that patients are going to experience. My constituents, your constituents, all of our constituents are going to suffer because of this bill. Look, man, I'm going to vote yes. I'm not going to voice vote no, because this is a common sense bill. It should pass. But spare me the improving healthcare when you just ripped healthcare away from millions of people.